Entamoeba, Entamoeba, subphylum Sarcodina, family Entamoebidae. Family members are called parasitic amoebae, which occur in the digestive tract of vertebrate and invertebrate. Movement by pseudopodia, holozoic type of nutrition, binary fission type of asexual reproduction. Ancestment is common feature. Family Entamoebidae, genus Entamoeba. Location digestive tract, usually from cyst have 1 to 8 nuclei depending upon the species. Genus Entamoeba. Species host number of nucleus present inside cyst. Entamoeba histolytica, man, dog, cat, monkey, pig, etc. Quadrinucleated cyst. Entamoeba coli, man, dog, monkey, pig, etc. 8 nucleated cyst. Entamoeba bovis, cattle, unnucleated cyst. Entamoeba histolytica. It is a zoonotic protozoan parasite. Mainly two development stages are found: trophozoite and cyst. Trophozoite size about 10 to 16 micrometer. It has clear ectoplasm and granular endoplasm. Entamoeba histolytica. Trophozoite. Endoplasm of trophozoite contain food vacuoles containing ingested erythrocytes and a vascular nucleus. Trophozoite move by finger-like pseudopodia. Presence in fleshy dysentery stool. Entamoeba histolytica cyst. Trophozoite discharges undigested food and condenses into a spherical mass called cyst, usually round in shape and 5 to 15 micrometer in size. Entamoeba histolytica cyst. Young cysts contain 1/4 chromatoid bars, glycogen vacuoles, and single nucleus, whereas mature cysts contain 4 nuclei without chromatoid bars and glycogen vacuoles. Resistant to adverse conditions, sensitive to desiccation, putrefaction, and temperature above 40 degrees Celsius and below -50 degrees Celsius. Entamoeba histolytica transmission through cyst-contaminated food or water, as trophozoites do not survive more than 30 minutes after passing with stool. Eating of raw and uncleanated vegetable, usually in the form of salad. Eating of food contaminated by fly, use of night soil, polluted water, etc. Entamoeba histolytica life cycle. Host get infection by the injection of cyst. Excitement occurs in the intestine in the presence of trypsin enzyme and release metacystic form. Metacystic form undergo nuclear and cytoplasmic division and form 8 nucleated daughter trophozoites, which migrate to the large intestine and grow into full size and invade the bowel mucosa. Life cycle of Entamoeba histolytica. Life cycle of Entamoeba histolytica. Mature cyst ingested exocytation, trophozoid multiplication, trophozoid fecal Entamoeba histolytica pathogenesis. Pathogenesis depends on various factors like strain variation, presence of Escherichia coli or Aerobacter aerogenes, nutritional status or host, concurrent disease, immunity, etc. Parasite penetrates the intestinal wall by the lysis of the epithelium by the action of phosphohydroly released by liposomes. Entamoeba histolytica pathogenesis. Amoeba multiply and invade mucosa to produce inverted flask-shaped ulcer. Amoeba may be reach other body parts like liver, where it may produce inflammation and abscesses. Entamoeba histolytica symptom: acute amoebic dysentery, Feces consists of almost entirely blood and mucus with amoebic abdominal pain with straining, chronic dysentery, recurrent dysentery, occasional abdominal pain, nausea, irregular bowels, headaches, flatulence, etc. Entamoeba histolytica diagnosis. On the basis of symptoms like feces with blood and mucus, abdominal pain, etc., microscopic examination of feces reveal for the presence trophozoite in diarrheic feces or quadrinucleated cyst, Entamoeba histolytica or 8-nucleated cyst, Entamoeba coli. 2% iodine is also used for clearly detection of cyst. Entamoeba histolytica treatment: metronidazole, tinidazole, etc. Control: adoption of proper sanitation, personal hygiene, proper disposal of sewage and night soil, avoidance of fecal contamination of food and water, supply of clean drinking water, etc. Giardia. Giardia family Hexametidae, genus Hexameta and Giardia. Both have two similar nuclei. Giardia morphology: two developmental stage, trophozoite and cyst. Trophozoite: pyriform to elliptical in shape and bilaterally symmetrical. Anterior end is rounded and posterior end is pointed. Giardia morphology: trophozoite. A large adhesive disc is present on the ventral side, whereas dorsal side convex. It has two anterior nuclei, two median exostyle, and 8 flagella arranged in two pairs. Giardia cysts. Cysts are oval or elliptical in shape with 2 or 4 nuclei and a number of fibrillar remnants of the trophozoite organelles. Genus Giardia. Species: host location Giardia intestinalis or Giardia lamblia, man, monkey and pig. Giardia canis, dog, upper digestive tract. Bovis, ox. Catty, cat. Capri, goat. Giardia life cycle: direct reproduction by binary fission, transmission through the ingestion of cyst contaminated food or water. Life cycle of Giardia: first, dog or other animal human come in contact with the Giardia cyst, ingest it, and the body become infected with Giardia. Giardia is now in trophozoite from within the small intestine, multiply with while feeding of the host and absorbing its nutrients. Giardia cyst exit the body through excretion and surfaces in the environment for months with the potential to infect others. Giardia pathogenesis: chronic diarrhea in men, especially children, interference in fat digestion which result deficiency in the fat-soluble vitamin. Clinical sign: giardiosis, behavior fever, result diarrhea, dysentery, and steatorrhea, fat counts with stool, and deficiency of fat-soluble vitamin. Giardia diagnosis: microscopic fecal examination reveal oval or elliptical shape, cyst contain 2 or 4 nuclei. Trophozoite stage may be found in diarrheic stool. Giardia treatment: metronidazole, tinidazole, febendazole, chloroquine, etc. Control: good hygiene and proper sanitation. Balantidium coli. Balantidium coli, phylum Celiophora. Balantidium coli, highly organized protozoan having 2 dissimilar nuclei, a large macronucleus responsible for cytoplasmic activity of the organism and the small vascular micronucleus concerned with reproductive process. Balantidium coli locomotion by cilia. Reproduction, asexual reproduction by transverse binary fission and sexual reproduction by conjugation. Balantidium coli host, pig, dog, cat, monkey and man. Location, large intestine, cecum and colon. 2. Developmental stage, trophozoid and cyst. Balantidium coli trophozoid, active motile stage and 50-60 micrometer in length at the anterior and funnel shaped peristome which lead to pseudopharynx or mouth. 2 dissimilar nuclei, example micronucleus, kidney shape and micronucleus lie in the notch of macronucleus. Balantidium coli trophozoid, 2 contractile vacuoles on at each end and excretory organelle, example cytophagy, present at the posterior end of the organism. Balantidium coli cyst, ovoid to spherical in shape, double walled, yellowish in color and 40-60 micrometer in diameter. Cysts are informed both inside and outside the host body. Balantidium coli transmission, pig is considered as primary host and in it Balantidium coli exists as commensal in the large intestine of most pigs. Pig is probably the persistent source of infection for man, cattle, etc. Hosts get infection through the ingestion of contaminated food and water with cyst of Balantidium coli. Life cycle of Balantidium coli. Life cycle of Balantidium coli. Cyst, fecal oral transmission, ingestion, colon, diarrhea, ulceration, hemorrhage, trophozoid, excretion, external environment. Balantidium coli pathogenesis and symptoms in pig. Normally it is non-pathogenic but occasionally invade the mucosa and producing superficial to deep ulcer with enteritis. It produces diarrhea and dysentery with hemorrhages. Balantidium coli pathogenesis and symptoms in man. Balantidium coli produce superficial to deep ulcer associated with enteritis. The initial lesions may resemble those produced by Entamoeba histolytica but do not show the similar tendency to enlarge or spread. Balantidium coli diagnosis, microscopic fecal examination reveals cyst. Trophozoid stage may be found in diarrheic stool. Balantidium coli treatment, tetracycline, metronidazole, etc. Control, good hygiene and proper sanitation, proper disposal of feces of pig and man. Thank you.